Well, you can forget about the price of eggs. It's really healthcare costs that are rising super fast. Double-digit premium increases are coming for 2026, and more of that cost is being dumped right onto employees. Meanwhile, weight loss drugs like Ozempic are adding billions to the bill. And then there's AI, a wild card that could either bring costs down or make them rise even faster. Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of Yukon Health. Hey, Dave, AI could be either a cost increase, which would be that'd be the conventional wisdom. With all this technology that we've added to healthcare, it's just added to costs. It could reduce costs materially, or it could be a nothing burger based on kind of the most recent studies from MIT. But let's hold that AI conversation for a while. Tell us, Dave, what healthcare costs always go up. Why are they in the news right now?
Well, because right at the point in time where people are saying, what's the cost going to be for 2026 as companies are planning their budgets and they're seeing, other costs, which are usually flat or up a couple percent. And healthcare is a big cost and it's up something like 10%. So it's actually is higher than normal. And the other reason, John, is because as we see this big, beautiful, bill, whatever it may be, come into play, and it's getting tighter for those folks that have Obamacare, they're going to see perhaps even bigger increases and a more difficult time getting coverage. So cost is on the mind, John, because there's some big announcements and big cost increases for next year.
Dave, I thought that the president was going to bring all costs down, like magic, overnight.
It is like magic, John. I mean, everything's being dictated by the president right now. It's like, what are the president's priorities for NIH funding and so on. And so I think it is with healthcare too, John. And basically, I think what he's assuming is that, hey, he's 79 and he's in perfect health, and all he needs for his healthcare costs is a little bit of makeup for his hands and a little something special for his ankles. So if that's all everybody needs, then maybe that's going to be the health plan, John. It'll be the Trump plan.
Well, I think let's unpack exactly why healthcare costs are going up. With Medicaid cuts, that means there's less funding for hospitals, but hospitals still have to be in business. With the reduction in the Obamacare subsidies, there's going to be more employees paying more for their insurance and more employers probably dropping that insurance and people falling off the exchanges. With fewer insured people, you're going to have those, the healthcare systems needs to get paid for. So those prices, that's just going to be cost shifted to the employers and the employees. Additionally, there appears to be some material increase trends that all of the health plans are saying they're seeing in their numbers. So even before the cost cuts and cost shifts, you're actually feeling an increase in healthcare cost. I think the Trump healthcare is going to turn into Trump healthcare inflation shock. And that's going to be we're going to have to find therapy to fix. And it's not going to be covered by just, a little bit of makeup here and there. Can't make up for healthcare costs running at twice the rate of inflation.
Well, John, people that are obese, like Mr. Trump himself, according to his doctor who was on here before, are eligible for drugs like Wegovy and Ozempic, these GLP-1 drugs. They're hugely popular. And theoretically, they might bring down costs over time. But in the near term, they certainly drive costs up. There's the cost of the drug itself, and then people go for more doctor appointments to get a prescription, and then when they have side effects. So that's also a factor.
Well, I think you're always pounding on the GLP-1s. I actually think the GLP-1s are probably a transformational drug, and actually the costs are coming down. They're not a material add to anything other than certain individual line items that are probably running pretty fast. But healthcare costs are going up everywhere, Dave. Don't blame those lovely pharmaceutical makers who are charging exorbitant prices for something that costs a third to 20% of the dollar at the rest of the world. They're actually, I think that's last year's issue, Dave. Wake up. This year's issue is expensive healthcare for everyone. The Trump healthcare plan appears to be less care, more costs coming to you very soon.
Fine, John. So I said, Okay, I said that these GLP-1s are raising costs because you have the cost of the drug up front. But there is a place, I guess you could say, where the costs are going down, but we may see the reverse, which is if no one can get a vaccine, John, then there won't be any spending on vaccines. That'll save some money up front.
But cost lives and illness later. No, the consistent attacks at undermining what we already know to be true, um, it's exceedingly painful. But I do think, Dave, that there's all this really happy talk coming out of Washington about things we're going to get rid of, like administrative costs and waste and fraud. But it appears that other than cutting the budget, most of this is just talk, not really regulatory mandate. Do you think there's going to be any improvement in healthcare based on the new administration's approach to healthcare policy?
Well, any is leaves it pretty wide open for there could be
I'm
some
just looking
improvement
for
somewhere.
something positive here,
Yeah,
dude.
yeah. Well, their AI, maybe their AI guidance will be helpful, and if they can help AI
I
get
thought
out
you
of the
didn't even
gates.
like that. You said
Well,
you're now you're flipping. Yeah, I got you. Beat you back on GLP-1s, and now you're sort of waffling on AI. Is
yeah,
AI good or bad? Like, pick a line here, Dave.
I'm trying to wait. My LLM is a little. I didn't pay my subscription. I guess it's not giving me the answer that I should have on the fly. I hear they have interviews like that, John, where you're supposed to like the AI pause. It's like, let me think about that. Let's talk about AI actually, John, because I'm not sure. A lot of times you look and say, well, will AI finally like bend the cost curve? Because you have something that's got to stop costs from going up, and that would be one perspective. But another perspective is, well, it depends, who has the AI and what they're trying to do with it. And I can certainly see some reasons why it would help drive costs up. So, for example, if I am a provider and I'm trying to bill, I might use AI to help my billing and maybe to fight through the prior authorizations faster. On the other side, the insurers are definitely trying to use it to tamp down costs. I would say when you see these examples, maybe outside of healthcare, like you heard about Delta Airlines using a lot of information and AI to say, "Hey, John, you look pretty desperate. Like you probably said something nasty to your wife,
Dave,
and
can
now
we
you need to take
please
her on an
stay to
expensive trip."
healthcare? Let's stay on
All
this.
right,
Do you
it's
you
gonna.
and you probably got in some awful healthcare Delta delay recently. But if we think about AI, you're hearing in a number of the large payers' quarterly earnings that they're complaining that the engineering of artificial intelligence is generating higher bills. But from my perspective, now I'm a little biased as the chairman of Waystar. If we get a cleaner bill with cleaner codes and cleaner notes that require health insurance companies to pay for care that's been provided by someone who who's qualified to provide it for someone in need, that's called better insurance, even though it's a little bit more expensive for the insurers. And I think what you are going to see, though, is both payers and providers leveraging technology. Because I do think that the possibility of taking costs out is more dramatically available now with artificial intelligence. And I actually think the administration is doing a nice job at cultivating a tech-friendly environment from a regulatory perspective to accelerate the investment and engagement of new technologies of traditional healthcare, which has been slow to embrace it. And there's a lot of it. We in the United States have a lot of administrative hassle that you'd expect, machine learning to be able to make go away, which could be a big pickup from us and could reduce the rate of inflation in healthcare. Don't you think that's possible?
Yes. So all of the crazy stuff that's going on right now, from sending the National Guard into Washington D.C., and there is crime in Washington D.C. I'm not sure it's always on the streets. Between that and all the things that are going on, you say, "Wow, we're really in big trouble." Now, it's possible that AI, if we look at the long sweep of history, it's actually going to be more significant, and the things going on in AI are going to be more dramatic, both in terms of improving the quality of healthcare and the outcomes, and potentially keeping the cost under control. It's far from predetermined. And I do think we should be looking for those opportunities to make healthcare better and at least not more expensive, if not
Well,
cheaper.
and this year, the ACA exchanges, the Obamacare exchanges, are projected to increase prices to the employers 15 to 20%. We need the help from artificial intelligence and machine learning to make healthcare more accountable, to reduce administrative waste, and hopefully reduce some of the friction. I think that what's hard is that I think it's kind of been oversold in the short term in terms of AI is going to be magic at your fingertips tomorrow across all industry. I think, but I suspect what's going to happen is what Gates says, it warns us about technology, and Bill Gates warns us about technology in general, that you overestimate it in the short term and underestimate it in the long term. And I think that's happening with AI right now.
I do think that people are more broadly understanding that because the lessons from the internet, where those who are old enough to remember, like us, just said, "Hey, I can get my dog food delivered for nothing," to then realizing, "Wow, it's profoundly changed everything." I do think AI is like that.
Well, and if you think about how quickly Google changed the way people thought about accessing knowledge, ChatGPT is growing. The consumer access to artificial intelligence is growing at 5.5 times as fast as Google's penetration. So it's consumers are engaging and embracing it, at least at a very high level. I think it's going to take a little time for it to insinuate itself into healthcare, but I'm actually quite optimistic. I think the challenge is it's happening at a time when you've got massive cost shift happening in healthcare that are going to kick inflation up in healthcare costs. And I think the Trump administration and the Republicans are going to pay a price for that.
Good. Well, that price may be inflated, and hopefully it is. So let's talk about, I think it's hard to say what's going to happen overall in the system, because you can see places where AI is going to push costs up and where it might push costs down. So let's talk about some things where it might be able to, have costs reduced in a way that's also enhancing quality. One that I have in mind is the diagnostic odyssey. Sometimes someone has something that's rare.
It's a very pompous way. Like, what are you talking about here? The diagnostic odyssey.
It's pompous, John. It's like, the royal. I'm talking about the Odyssey. The Odyssey, there's a book, and they had those. And it was actually probably before it was written down. But it takes a long time to get a diagnosis, especially have something unusual. And during that time, first of all, people suffer, and there's also a lot of expense in the system. And then when you ultimately find out what it is, it may be more costly to treat and less effective. So if you could find out very quickly that you had a rare disorder, what it is and what the treatment is for it, then you could imagine AI integrating all this sort of data that's out there to be able to do that. Then that's going to be better for the individual, and it's going to be less expensive for the healthcare system. And I think there's a lot of different examples of those odysseys if people can't think about them.
Well, there's two aspects to that. It currently takes 15 to 17 years between the time something is actually accepted and understood by medicine as a new mode of care or a new standard of care to be actually to be propagated and spread throughout healthcare. So if that's a long time, I would hope that artificial intelligence at the point of care would allow caregivers to learn more and of what we already know to be indicated and correct and integrated into the current care loop. And the other piece of the diagnostic journey is figuring out what you've got and then leveraging all of the facts available faster. I think both of those could be big pickups for machine learning and artificial intelligence and could help, even if it doesn't reduce costs, really reduce suffering.
Do you think that there's going to be now the combination also with the consumerization of healthcare that's going to have an impact there? So, in the first part of the internet, people would be very interested in their own health. I mean, it's fundamental. And they bring in these long printouts. The doctors would sort of poo-poo it and said, I had to spend the whole appointment explaining why that wasn't right. But the patient really does care about it and they're motivated. So if you've got better tools, as opposed to like Dr. Google, but using AI for your own diagnosis and putting in all the information and then working with your healthcare provider, I mean, is that going to be a benefit? Is that the way you get there? Or is it more about having the medical profession leverage AI?
I think that AI, we're still getting our arms around where it's going to have an impact and how much. I think the most important thing is for everyone to embrace it at some level. I'm a little bit skeptical. I think that the move from authority to student, the way doctors and patients used to deal with in our parents' generation, has already shifted. So the consumer's engagement in their own health and feeling accountable and engaged and in the detail, that's already happened. So all you're doing is accelerating access to better tools with AI. I don't think it's going to really change that. What it's going to potentially do is make the entire system more accountable, because with more access to better information, you can hold your doctor, your hospital, your clinician, your physical therapist to the best standards that you can identify, leveraging the big brain of artificial intelligence. But I don't think it's really going to change the relationship. It's just going to make, and both the doctor and the patient are going to be equally empowered if they're using these tools appropriately. So I think hopefully it'll just improve the care. I don't think it's going to really change the way consumers access and relate to their caregivers, unless their caregivers are totally disconnected from AI. I mean, what do you think?
So if we talk about like the doctor-patient relationship, how does it affect if I'm there with my physician? That's one element of it. And I agree it has shifted. But people still have to be the quarterbacks for their care, even though you've got all these, care navigators and other things that people try to put in. It's really kind of the consumer.
You have to be your own and your family's care navigator. Don't delegate that to anyone.
And it always seems like every time I'm involved in that, somehow it's like, wow, how do people do this? And it's very overwhelming, especially at the time you're sick or dealing with stress. And I wonder whether an underappreciated possibility for AI is in that coordination side. Can AI be used, even if it's directed by the consumer, by the patient? Can that be used to help to organize the whole care team, keep them informed, allow them to communicate the relevant information? I don't know, but that seems like a real pain point that I haven't seen directly addressed. I'd like to see it.
Maybe you build an app, Dave.
Yeah,
we could take you public. No, I think that the reason you haven't seen it is I think it's tricky. It is, there's a level of complexity there that we still haven't solved for. But it's interesting. You actually could see an agentic companion there that could be pretty powerful.
And what about for mental health, John, behavioral health? This is a big factor, and you've actually seen some things. I mean, here's an example where AI can be great, right? It's hard to get an appointment with a therapist. You can get an appointment with ChatGPT in half a second. And that can be positive for some people, but then you hear about people going way down the deep end and sometimes actually being given information that's not super helpful to them.
Well, I think if you're dealing with a principal provider, I mean, we've had some folks on the show that are, I think the only way we solve for the lack of supply of therapists and caregivers and the increasing demand for care and mental health and behavioral health is through technology. So I'm hopeful here because I think we have to be hopeful because it can be a solution. But you shouldn't be dealing with generic bots on this, or bots that you help engineer and customize yourself intentionally or unintentionally. You should be going to a recognized provider of psychiatric and social work kind of care that's leveraging bots so that they're tuned to what would really be effective. Because there are actually good standards on things like cognitive behavioral therapy and opioids use and abuse, and recovery. But I would just be careful there. But no, I'm more of a techno optimist here, in spite of your, kind of typical Luddite skepticism.
Yes, indeed. Luddites weren't too successful, John. So we've been talking about healthcare costs and kind of the policy, big picture side of it. There's only one person in this country that wields power at the moment. So if we put him aside for a second and say, is there anything an individual can do, either someone who's employed at a big company or self-employed or on Medicare or Medicaid, anything that they can do to keep costs under control for 2026?
It goes back to the basics, probably eat more vegetables, get outside and get in the sun, a higher level of physical activity, and maintain your social connections to your friends and family. The basics still matter more than the esoteric new stuff. The math shows that people who are, stay active, stay engaged in their community, have a sense of purpose, are connected to their friends and family. I think the one thing you can do is make sure you've got access to a decent care and to decent caregiver. But the basics of if you really want to be accountable for your health, be accountable for your daily activities that affect health. And that's probably the most important thing It's going to actually drive. It's not novel advice, but it's the right advice for folks who in the current environment. As you think about care navigation, it'd be best to navigate away from care and towards better health.
Great. Well, I'll end on something a little less uplifting, which is that a lot of the savings that are coming from federal programs in particular have to do with erecting hurdles so that people who are actually eligible have a harder time accessing. So things like shortening the open enrollment period or getting rid of auto enrollment and having more, income verification means it's particularly important.
Oh, it's part of how they're going to just cut the rolls in Medicaid. They're cutting costs by complicating access.
Right, but that makes it essential that people continue to act the way that they have. And instead, if you want to do something for yourself to make sure you have coverage, don't miss that shorter open enrollment period. Make sure you get the verifications in. Don't assume that that the government is just trying to help you out by keeping you on a program, because that is
don't ever
no longer the case.
assume the government's just trying to help you out, Dave. Got to be accountable there too.
All right, John. Well, I don't make any assumptions about my health, except that if I spend too much time in the sun, I am going to bake into a lobster and going to be at my dermatologist and maybe my oncologist. So that's it for yet another episode of CareTalk. We've been talking about healthcare costs. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of UConn Health. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service.